welcome Dr. Vishal Akula sir, Professor and Head of the Department, Government Medical College, Jagityala, is a National Direct Council member, IPS General Secretary, IPS General Secretary for Indian Psychiatric Society, Telangana State, and also sir is in the Working Committee member, Indian Medical Association, Telangana. He has been a Vice President of Indian Medical Association, Nizamabad, and also Telangana convener, State Mental Health Committee, Indian Medical Association, Telangana State. Our next speaker is Dr. Neeli Ramachandar. Sir is the Chief Organizing Chairman of the National Pedicon 2025, former Vice President of National IAP 2014, Chairman of the Central Zone Pedicon, first elected President of the IAP Telangana, Chief Election Commissioner of IAP Telangana, former Chairman and Secretary of Indian Red Cross Society Nizamabad, former President of IMA, IAP, Private Nursing Homes Association Nizamabad. Next speaker is Sir Dr. Sridhar Dandapalli sir. He is a consultant psychiatrist at City Neuro Hospital, Hyderabad. Last speaker, Dr. Asha Monica. She is an assistant professor in Department of Psychiatry, Government Medical College, Jagityala. I welcome all the speakers and I hand over to the first speaker.
Among children and adolescents has never been more critical. We are fortunate to have three esteemed speakers with us today. Dr. Ramachandar sir is a senior pediatrician and organizing chairperson of Pedicon 2025. He will guide us with his vast experience. And Dr. Sridhar Dandapalli, consultant psychiatric, City Neuro, will offer insight into the psychiatric aspects of this issue. Finally, Dr. Asha Monica, assistant professor of GMC Jagityala, will shed light on the academic and developmental perspectives. So I am Dr. Vishal Akula, and it is an honor to set the stage for what promises to be an enriching and insightful discussion. Let us work together to better understanding and address this growing concern. So now I would like to invite our main speaker, Dr. Ramachandar sir.
Respected fellow panelists and dignitaries of the dais, dignitaries and audience on the dais, of the dais. This online gaming addiction has become a major concern in the pediatric community, in the tweens and teens. Both groups are being suffered with the online gambling addiction. Most of the times we pediatricians drew up a blank face. We don't know where to begin and where to end. It all started like this. During those days, 30, 40 years or 50 years back, mothers used to say, Chanda Mama Rave, Jabili Rave. Mother used to take her child outside the home and she used to show everything in and around in the sky, whatever else, what else. Now these, it has gone, it is now outdated. Mothers don't have time, don't have energy. They keep the screen. From neonate to the man in the 90s, for everything, screen has become an addiction. Without addiction, without internet, they are going into psychosis. So it's all starting here, from neonate to, almost from neonate. It is not an exaggeration. From neonate to till the teens, everyone has become addicted. Without screen on the height, they are not eating. They are not doing anything. They are not listening to the parents. It has become a rebellion from the very early age itself. So, coming to this definition, persistent or recurrent gambling behavior that leads to significant impairment in personal, social or academic areas. This is reflecting on the scholastic performance of the child. In those days, 30, 40 years back, when scholastic performance was poor, we were thinking of anemia. We are thinking of malnutrition. We were thinking of the poverty of the students. Now it is on the contrary, it is just reverse. Everything is well off and the kid is showing poor scholastic performance. Very bad thing. And this criteria, impaired control over gaming, increased priority given to gaming, continuation despite negative consequences, psychological low self-esteem, anxiety, depression, These are the things which we used to see in the adults or in the elderly groups. But these are the things that are manifested in the very early age, in the very childhood. Peer pressure, social isolation, environment, easy access to game. The signs and symptoms, the key points are behavioral preoccupation with gaming and lying about gaming, emotional irritability, mood swings when not gaming. Then these are the things. This is like a kind of blackmail. Internet gaming disorder scale, DSM-5 criteria. There is an urgent need to differentiate between hobby and disorder. Otherwise, there is no need for any third world war or fourth world war to see that this generation it lands in a tragedy. The key points: mental health, and I already told, anxiety, depression and attention deficits, physical health, obesity, carpal tunnel syndrome, vision problem. These days we are seeing poor interpersonal skills and family conflicts. The child is unable to go outside and play with his friends. Rather, he is keeping himself busy with the gadgets. Gradual reduction in gaming time, and we should be ready to treat any underlying conditions like ADHD or depression. Role of counseling: we should educate families about the disorder, develop coping strategies for children, establishing a balanced lifestyle with hobbies and physical activities, encouraging open dialogue with families. Prevention: parental involvement, monitor screen time. We should always monitor screen time. We should set a standard, either 1 hour or 2 hours, morning 1 hour or evening, morning half an hour, whatever it may be. With gaming habits, school programs, workshops should be conducted on digital well-being. In summary, online game addiction is a serious health concern. Early diagnosis and intervention are crucial. Counseling and holistic management can yield positive outcomes. Call to action: let us work together to support children in leading balanced and healthy lives.
I am Dr. Sridhar, consultant psychiatrist, City Neuro Center, Hyderabad. So today, Dr. Ramchandra sir said briefly about that gaming disorder and all. So here we are going to discuss deeply about the psychiatric part. So in psychiatric aspects. So usually that gaming addiction is like any other addiction, which is involving like substance or drugs, any other addiction. The same way it is also addicting in the brain. So why we are thinking about the internet addiction? Because internet addiction is a spectrum of disorders, which includes the video gaming, online shopping, gambling, and social networking. But majority of the studies are happened on the internet addiction. So that we are discussing that internet addiction, gaming addiction, these are the terms are interchangeable. So what is the neurobiology of the internet addiction? The neurobiology is the same like just we discussed like same like earlier substance and the drugs addiction, which involves in the dopaminergic pathway. So especially anterior cingulate and orbitofrontal cortex and nucleus accumbens will be involved. And the long-term use of substance decreases the synaptic activity. Give the cues, then they will have more and more craving, they will get it. This is the principle where we can use for, if we remove the cues, so we can try to make them to avoid from the addiction. So this is the one of the non-pharmacological management principle we can use for it. And this is the pathways, usually for the craving and addiction pathways. And these are the chemicals which we use to dopamine, GABA, and opiates, and glutamine. These are involved in the addiction pathways. And how to identify the diagnosis part. Why to identify and how to identify. How to identify? By careful history examination, like a careful history from the parent side, or history from the student side or engaged adult. And why to identify? For the better outcome, to make the informed choices of the treatment. So patient is also having the, we can explain the treatment modalities and the duration of the treatment. So if he is, so that the compliance will be more compliance will be more better, and they act successfully in the navigation of the addiction treatment. So what are the signs and symptoms? These are the main signs and symptoms. with these signs and symptoms, gaming and lying and hiding game use, and social withdrawal, loss of interest in other activities, and psychological withdrawal, and they use that this gaming addiction as a psychological escape and continued use despite its consequences and physical health issues. So we can identify by all these group of symptoms. So now we are going to discuss each and every. So most of the time then, because they are having that internet gaming addiction, they will get some rewards. So because of that, most of the time they will feel that they are like real winners in the gaming, they are real winners in the world also. So they will fantasize about themselves and they want to enjoy the time with gaming only. So they neglect the other work like school work and office work, they will neglect it. So they fantasize about themselves like a real heroes. So because of the spending most of the time, so obviously they miss their work, so the productivity will be decreased, the school performance will be reduced. So if you ask that, usually the parents will ask that, they started to tell the lies and the new behavior will start. And they don't eat, so they don't take much rest and they don't follow the parents' orders also. So if they want to spend more time in the gaming, so that they will avoid from the society. So they want to themselves, so sit in a room and trying to play in the game, so that socially they are withdraw from everyone. And apart from that, now the new options also came inside the gaming, like example PUBG. They can chat with other people, even though they don't know about themselves, even they can chat it. Recently we have seen that one incident, one lady from India to Pakistan, she left her family and she went to Pakistan and married that guy because of the PUBG friendship. So these unwanted friendships will develop and loss of interest in other activities. So most of the time they spend more time in the gaming, so that they will not focus on any other activity, like any other physical activity or academic activity, social activity. So just they want to spend more time in the game. So not only social withdrawal, and they will become like emotionally unstable. So they will become gradually what will happen, the personality will be changing. So the borderline personality will develop. In future they may develop the borderline personality. Because of that, this emotional instability, sometimes while gaming also they will get some ads, like some betting apps, they will give some ads and they will go inside the gambling disorder also. In future they will develop to that side. And whenever they feel low or whenever they feel sad, then they will think that this is like a psychological mechanism. So they want to escape and they want to go to the safe place, that is removed from the real issues, so that that will be acting as some psychological defense mechanism. So even though they know that, just like any other addiction, even though they know the consequences also, they want to continue it because they are addicted to that level. So what will happen? They drop out from the school and they don't care about their personal hygiene and self-care. So even if they are the young age people, they may lose their jobs also. So with the continuous use of screen time, so they will develop, mostly they will develop with the refractive errors of the eye. Because of that, then the headache might be developed and there is no physical activity, so obesity will develop. So they don't eat properly, malnutrition will develop. Because of all these things, and multiple infections will develop. And finally then even they don't sleep also. So almost all psychological symptoms will develop. So how do we diagnose in a professional way? This given in ICD-11, the code is 6C51. So that is the persistent pattern of gaming behavior which may be predominantly online or offline, manifested by all of the following: impaired control over gaming behavior, and increasing the priority given to the gaming behavior to the extent that gaming takes precedence over other life interests and daily activities, and continuation or escalation of gaming behavior despite negative consequences. And the pattern of gaming behavior may be continuous, episodic and recurrent, but it is manifested over an extended period of time. The gaming behavior is not better accounted by for any other mental disorder like a manic episode, and not due to any effects of the substance or medication. And the fourth one is the pattern of gaming behavior results in significant distress or impairment in the personal, family, social, educational, occupational and other important areas of the functioning. Usually it is in a progressive in nature, so it will gradually it is increasing, but it will be episodic then if we are able to manage also. So these are the differential diagnosis we have to, for the diagnosis these are the differential diagnosis part. So the gaming disorders, it's a boundary with the hazardous gaming, and gambling disorders and bipolar related disorders, obsessive compulsive disorders, disorders due to substances use, and the effects of other psychoactive substances including medication. So if we are concluding that the child is having the gaming disorder, we have to rule out all these conditions also. These are my references. And the next speaker will continue this.
So nowadays you know that using a mobile tab is not asking him to cut down using cell or tab completely is not a practical solution in this age. So what do we do about this? So we need to understand the risk. So what is the risk associated with use of these things so abundantly should be understood by both the parents and the child. And then we have to empower children with skills to help them in engaging this technology in a safe way, because we cannot avoid. So we have to teach them to use these things in a safe way. And then we encourage and nurture alternative interests. So this is a huge problem in today's lifestyle. We can say that, see, I just want to give my example. So I work as an assistant professor at a place which is 60 kilometers from my house, and my husband is a practicing urologist, and I have my mother-in-law staying at home, and she's a very old lady with her own physical diseases which she has to tackle with. So when my kids come home, they're free to access everything. They're literally free to access everything at home, and they don't have friends in the vicinity of my house, so they immediately turn to what is available for them, what is going to engage them immediately, which is a mobile, TV or a laptop with games. So encouraging and nurturing alternative interests and hobbies also is a challenge for us nowadays. And then create opportunities for real-time social interactions. So at the end of the day, when two working parents have a free day, they relax and watch something on TV nowadays. So how do we create opportunities for social interactions which are offline? So online social interactions is what we have taught our children nowadays, like connecting people through WhatsApp calls. Everything happens on mobiles, tabs and laptops, whatever. Or there are other extreme of patients who feel that it is acceptable, let them see, they learn something from that. So there is a balance which parents should understand that should be achieved, that is safe for children. Because tomorrow we have to deal with these appearances only. So we have to educate parents about the safe level of technology use, and then effective communication. How to effectively communicate this to the kids. Like if the parent says, you should not use it, what are they going to understand? They will understand nothing. They'll go back and do it without our knowledge. So we need to tell them what is that we're expecting from them. Why are we asking them to cut down the screen use or gaming use? What we are what are the problems they might face, and also they should try to educate them in or teaching them in teaching the children to seek hobbies. Like for example, let's say your child is cutting some papers, doing a craft. No, my house is going to look messy. Don't do that. Go and watch something. That is not the way. If they are doing something which is going to cause you little trouble also, we have to, the parents should understand and encourage them to develop alternative hobbies. Like the kids, they don't know everything firsthand, and parents need to be patient enough to teach them, and if they make mistakes, we have to be patient enough to make them learn from their mistakes. And then engaging is, let's say my kid wants to open a Facebook account, or he wants to enroll in something, some social media. All his peers have had a YouTube channel. So I say no. How would the kids listen? There's lots of peer pressure. So sit along with them. Both of you have a conversation about what you're going to do with that, and please inform them that you're going to supervise it. So saying no is not going to help. You have to communicate these things and engage with them in order to have a safe use of technology. And then assist them in these things. Like if they want to do something, say they want to use internet in a certain way, you cannot say I'm not going to teach you. They learn in the wrong way. Why do you do that? We assist them in learning properly. We assist them in learning correctly. So that is the thing. And monitoring has to be openly discussed with the kids. So I'm giving you a tab. I'm going to place a certain control over it. I'm going to monitor what you're going to see. This should be communicated with them. Then only it will be a honest communication between both the parents and the kids, so that there is some sort of control on both the sides. The kids also can negotiate with the parents about what they want, and the parents also can have certain amount of control honestly with the amount of technology use. So teach the child balance. Balance is, yeah, I want to play this game. Okay, play this game. But there's a time for studying also, learning this also on this. So you have n number of things you can learn in this. So gaming is not the only thing. These are the things they have to negotiate, and the child has to learn the balance, safety. So in while gaming, like Sir said, you share information, you make friends, you believe everything what the other person says, and that leads to lots of troubles. So explaining kids that what is being communicated to you from the third parties whom you meet on internet is not always true. Also, what you always see in Google is always not correct, is something which will help them understand, like about sharing pictures, whatever data they have. All those things you have to communicate, and you have to teach the child to use the technology safely. Then need to invest. See, why I don't invest is making social relationships and making them work outside of offline thing has become a very difficult task nowadays. So if you take some time, if you invest some time now and build such relations for your kids, it's going to reap lots of benefits for them in the future. And alternative recreation. This can be even simple games like, practically word finding games. Who's going to spell out the biggest word? These kind of games you can do even while working. So those kind of alternative recreation. Kids are not going to stay idle. They need to be engaged. They need some kind of motivation, stimulation. They need to be engaged in something. So even if you have work, some kind of alternative recreation, as we've already discussed, effective communication from the child side, right? You have to encourage them to spell out what they actually want, what they actually feel, why do they feel wronged. See, when we say don't do this, don't do that, they feel wrong. They feel like my friends' parents are doing something like this, so why not my parents? So we need to communicate that clearly with the kids and explore other areas of interest. If they are interested in music or something, some art or something, we have to encourage them while monitoring to learn those things on internet itself. You cannot practically carry your child to a music class, a dance class, whatever she is interested in outside. But leaving them without the choice of learning is not right. There are so many other alternatives through which they can learn. So we need to allow them to explore their other areas of interest so that they don't stick to one single thing, one single game which is repeated over and over. You don't have a dairy like anything. You get reports on an online app. You get all activities or whatever assignments have to be done. They're all digitalized now. So schools play a very crucial role in having some control over children. See, when they allow us to use internet and all so prolifically, they should also take the responsibility of explaining both the parents and kids about how to make use of their digital teaching program. This is what we are allowed to use in our school setting. They have to have firm guidelines and strict rules about that. And teacher training to understand or to identify the early signs of addiction, like the symptoms which sir has explained. So they have to be able to understand or identify where the kids are slipping, and they need to evaluate. Such training should be given. And there should be collaboration between the teacher, staff and the parents and the family. And we've already discussed this. Yes. So, okay, what we have already discussed is how we are going to prevent someone into falling into this thing, like gaming addiction. What about when one is diagnosed? So then we do parental education about what we have already discussed, and we teach them reinforcement strategies, how to use reward and penalty as a way that this is the problem. I want to change. It is not immediate. You cannot, a person who's playing 10 hours or 12 hours, you cannot ask him to stop now, today, you're not going to play tomorrow. So we have to educate the parents about their behavior monitoring and supervision, and as we've already discussed, we teach them the art of effective communication. And advice regarding engagement of the children in various, this is also like we discussed, so I'll just skip this. So, control and supervised use of, see, this particular thing, so advise weekly detox day, and this detox is not strict. This is very, the therapy is all very tailored to the kids and parents' needs. Both of them should be taken into account. And weekly improvement log and process achieved by the coupled with frequent contact. See, follow-up is the most important thing when it comes to the therapy sessions. So, both online and offline sessions and constant follow-up through calls can be help in maintaining the therapy. And treatment of comorbid psychiatric disorders, if any. So, if you think that the addiction is at a certain level where the kid is acting out, or he has one of the comorbid psychiatric disorders, you can start cognitive behavioral therapy for internet use. So there's a particular module given by Young et al. In 2011, which is for general people, actually, adults, but that can be tailored to children, modified to their age, and it can be used. And separate parental sessions for them to understand what techniques are being used and how to monitor urges. Compulsory addresses related to gaming, like if they cannot stay without the thoughts or the need to game immediately. And frequent parental education and counseling sessions to address the problem, and group psychotherapies, especially for those who have severe gaming addiction. So these can help. So I'm concluding the session, and I'll ask.
Thank you, Dr. Asha.
Already discussed. So, key pharmacological options, especially antidepressants and mood stabilizers, stimulants, and gabapentin. So, especially in online games, we should treat these symptoms. So particularly antidepressants. SSRI, you know about fluoxetine sertraline, it's the safest drug, reduce symptoms of anxiety and depression. It reduces craving and urges, particularly for addictive behavior. And mood stabilizers, lamotrigine is safest drug, can help regulate the mood swings and impulsivity. And stimulants, especially methylphenidate, amphetamine, address attention-related issues that may contribute to gaming behavior. And gabapentin may elevate anxiety and improve impulse control. Many individuals engaging in online gaming experience various mental health challenges that are comorbid to internet gaming disorders like depression, isolation and social anxiety, aggression and behavioral issues, post-traumatic stress disorder and sleep disturbance. So regarding internet gaming disorder, both bupropion and escitalopram were effective in treating and managing internet gaming symptoms. And bupropion appeared to be more effective than escitalopram in improving attention and impulsivity. So, pharmacotherapy, especially atomoxetine, selectively inhibits the norepinephrine reuptake. Bupropion blocks the reuptake of norepinephrine and dopamine. And methylphenidate decreases the dopamine D2 receptor availability in the state. So, according to Park et al., atomoxetine was started at 10 mg per day and increased it to 60 mg per day during the first 2 weeks of treatment according to individual symptoms. Regarding this bupropion was started at 150 mg per day during the first week and then increased 300 mg per day over the following 5 weeks. The methylphenidate, the initial dosage was 18 mg per day. This was adjusted during the first 4 weeks based on changes in clinical symptoms and weight. Depression, especially in depression, selective cytokine reuptake inhibitors, especially escitalopram, fluoxetine and paroxetine are shown to be effective in treating depression. So regarding social anxiety, bupropion SR and sertraline were comparatively effective. Both were in methylphenidate possibly reduce aggression in children with comorbid ADHD. Mood stabilizers, especially but in pediatric age group, lamotrigine and divalproxodium is safest drugs. Antipsychotics, haloperidol and risperidone, olanzapine may help to reduce the aggression and behavior issues. And regarding sleep disturbances, studies suggest that people with internet gaming tend to have sleep deprivation and diurnal sleepiness, in line with finding that people who engage frequently in gaming are likely to delay their bedtimes and shorten their total time spent in bed. Internet gaming may also arouse central and autonomic nervous system, which may subsequently lead to increase in sleep latency. Prolonged gaming may lead to physical discomfort such as muscular pain and headache, which may impact sleep quality. As a result, engaging more frequently in internet gaming may lead to poorer sleep. Short-term use benzodiazepines are helpful, especially clonazepam. Post-traumatic stress disorder. Childhood trauma could affect internet gaming disorder directly and indirectly via symptoms of depression and anxiety. SSRI such as sertraline and paroxetine are considered first-line treatment. Bupropion may also be of use. Regarding conclusion, pharmacological behavioral therapies. So thank you very much for giving this opportunity.
Thank you, sir, for sharing your experience.
Both are working, and child is rearing by any maid or nanny. In that cases, how we can limit mobile or laptop use or internet? So
Explain how to engage the child and some supervision, like usually you don't leave nannies if you have a CC camera or something. Some kind of control or supervision should be always there when we are leaving a child with the nanny, and the contract should directly be with the child itself. The parents and the children should work as a team to form a understanding about what is the extent to which the internet is being used, and they can have apps which control or through which they can monitor what the child is using, so that if the child is using something else in the presence of nanny because she doesn't know, the parents will know because they have already established the fact that they will monitor. So they will monitor and guide the child accordingly. So this should be something which the parents and child should come to an agreement to. Because if there is no agreement, the child is free to behave however he wants. So there is no control. So parents' involvement directly or indirectly is the most important thing which will help.
Like tab addiction. So he was playing. So both are doctors, they can't sit at home. even the maid is himself, he is also addicted to mobile. So what they were doing, so they installed CCTV, so they were monitoring. So if he is watching randomly when we are having the gap in between the OP, so they monitoring and they call the guy to stop all those work, so that they will have some fear, like someone will be watching, then we should be controlled.
Yes,
So that's the thing, we have to make some other alternatives, so that reduces somewhat.
Thank you.
Yeah.
And it is very difficult to explain that to the parents, that and what the rationalization they used to give up, they will tell that if I want to be a cricketer, I will spend more time on cricket or football, and my academics is just going by the side. So I like to ask you sir and madam, that what is your take on that? And second one, use of aripiprazole also in these kind of conditions, as it also helps in the impulse control. Yes, and he is doing his academic moderately, just passing the exams and everything, has good social connections as well, but he spends more time with animation, content creating, those kind of things. And this is not the one case. I am getting these sort of cases are there. And there are significant conflict between parents and
Sir, actually, my daughter who's third class, she wants to start a YouTube channel. So, so this is something which has been a very prevalent thing among that age group, kids and all. So, in place of saying them to stop, asking them to develop skills which are required for that. Like my daughter said, I said her, you learn what you're good at. So you need to show content, then you have to show something extraordinary. Learn something like that. What is your specialty? Do something about it, then they'll start. So if we say don't do, they will find some way to do it in a wrong way. Why do we do something like that? Why don't we say, or we can explain to them that, okay, fine, let's do that, but on par with the studies. So there's a certain age when you can do that, whatever you want, or it should not disturb. So the parents should be able to communicate these things to the child in a proper manner. Only then there will be some effective solution for this. And impulsive adolescent age itself, some amount of impulsivity is there. So if it is not significant, why will they feel again stigmatized that something is being given to them? That's my opinion.
I thank all the speakers for presenting all their valuable information. Dr. Neeli Ramchandra sir has taken an overview, and Dr. Sridhar Dandapalli has discussed about the neurobiology and the diagnosis, how to differentiate between the general and the disorder in online general use and the disorder. Dr. Asha has discussed about the prevention at different levels, at parent level, school, and different levels, how to handle. And Dr. Vishal sir has discussed about the management, pharmacological management. I thank all the speakers for sharing their expertise here, and I thank one and all for your valuable participation. Thank you.